Do a pint each time, 10 minutes, hold it. I mean, I can't legally, medically, I can't recommend people do coffee enemas because I'm a licensed physician, and you're not supposed to recommend anyone eat yogurt unless you've examined them in your office. But speaking theoretically, intellectually, and philosophically, I think the whole world should do enemas only if the whole world wants to be healthy. And I was once confronted at a conference by a well-meaning Orthodox oncologist who came to my lecture. To his credit, I mean, he was willing to sit through and listen to me yap for an hour or 2 hours or whatever it was. But at the end, he raised his hand very aggressively, and he kind of confrontationally said, "Coffee enemas are so abnormal." And I looked him right in the eye, and he expected me to defend. I said, "You're absolutely right, doctor. They're totally abnormal. The problem is we live in an abnormal world." And I said, "When you remake the world perfectly with no pollution, I'm going to stop doing enemas. Until that point, my liver needs help, and so does yours." Everyone kind of laughed.
No, it's true. It's actually very ancient. It's very modern, what you're saying, but it's also very ancient. I mean, it really validates what the Chinese have always known, doesn't it?
Well, in the Egyptian medical papers, they recommended coffee enemas specifically, and they're in the Chinese literature. All the ancient literature recommended enemas. Most of them recommended coffee enemas specifically because coffee, when you take it rectally, stimulates through a reflex the liver to work more efficiently. Now, oddly enough, when you drink it, it suppresses liver function. There's a completely different neurological effect drinking it as opposed to rectal.
Do you have coffee in the mornings, though?
I don't drink it. I never drink coffee. I have no desire to do it. It just makes me feel so irritable and hyper. I mean,
what do you drink in the morning when you get up?
I drink water and a tablespoon of bentonite. Bentonite's a liquid clay that's a detoxicant. So I take a glass of water and then I make my breakfast. Now, I'm more on the meat-eating side, so I usually have some organic range eggs and some organic bacon.
Can you detox too much, do you think, ever?
Well, yeah, there was that famous Journal of the American Medical Association study from 1980, 2 deaths due to coffee enemas, was kind of a joke. One of these patients...
Sorry.
Yeah, well, it was a joke. Typical conventional medical literature, usually they're jokes. People, again, respect them so enormously, but if you only knew the fraud that goes on in so much conventional medical publishing. Anyway, this particular article got a lot of publicity. I actually tracked down the stories and the families and all that. One of them was a woman who had a gastroenteritis, and she was throwing up and had diarrhea, and on her own started doing enemas at the rate of 4 or 5 an hour, and after 32 enemas had a grand mal seizure and died. Well, just having diarrhea and vomiting can cause electrolyte imbalance, and you can have a seizure. And, of course, doing 32 enemas in an 8-hour period, that was not something I would recommend. I mean, when I was in research under Dr. Good, just to prove they were safe, I did 16 pints a day, 16 enemas a day for a period of 2 weeks and monitored my electrolytes, and they stayed perfectly normal. Everyone was taking bets how long I would survive. This particular woman was throwing up and had diarrhea, so the last thing she should have done is extra enemas, although she may have died anyway. Had she not done the enemas because she was throwing up and had diarrhea, she needed to be in there's one case where a hospital would have been helpful just to rehydrate. She got dehydrated and had electrolyte imbalance. So, yeah.
A lot of the stories that we hear are really incomplete. They don't tell all the detail.
Yeah, the other case in that particular article, that article is still used 30 years later to prove coffee enemas are dangerous. The fact that, 10,000 people die each year from aspirin, no one's even discusses that. It's a big yawn, so we accept that. But enemas, God forbid, 2 people died. Well, that was the one case. The other case, which I also tracked down, was a woman with widely metastatic cancer that had failed standard therapies, went to a clinic in Mexico, was doing enemas, and died. And they tried to blame it on coffee enemas, but at the autopsy there was virtually no evidence of coffee in her bloodstream because you don't absorb that much, and their electrolytes were normal. They still tried to hypothesize that the mere fact she did coffee enemas means she had to die from that, not from the metastatic cancer that was in her brain or liver or lungs. That's not what killed her. It was the coffee enemas magically that did it, even though the pathologist from Seattle who wrote the article admitted that there was no evidence of an electrolyte imbalance, and there was only minimal coffee in her bloodstream. But they still tried to say, well, it's still the coffee enemas. Just like with Steve Jobs, no one says, well, he shouldn't have done the liver transplant or the Whipple and the immunosuppressive drugs. It's the good nutrition he did for 9 months that delayed the surgery that would have cured him, even though there's no evidence that that's the case.
What do you think about D3, what we're finding out about D3?
I think it's overstated, like my bioidentical hormones. We find with our patients, I have patients coming in. I had one patient came on 50,000 units a day.
Wow, I've never heard of that. I've heard of 8,000 or 10,000.
I almost fell out of my chair, and it takes a lot to make me fall out of my chair, but I was absolutely stunned. The problem with D, it's very tricky, because if you take too much D, and everybody's body is different as to what's too much D, the cell receptors for D are withdrawn.
D or D3? Because apparently D3. They're quite different.
No, D3. I'm talking about
D3.
D3.
All right.
D3, the receptors are withdrawn. So the more you take, often the worse the deficiency can get. And we find very often with patients who come in here on huge amounts of D, 5, 10, 15,000 units, they still are considered deficient. The first thing we do is we lower the dose. We go down to 2,000 units, and the deficiency often magically just resolves. Some people need more, but rarely do we go above 3,000 units a day.
They're finding some interesting things about it, though. It's considered the sun vitamin.
Oh, I understand. I understand the value of D. You know, I've read the literature on that. I mean, D is, it's called the sunshine vitamin. It's made by the action of ultraviolet light in the field of about 290 to 315 of the ultraviolet B wavelengths on the skin. Converts cholesterol into a vitamin D precursor. Then it's processed in the liver and the kidney, and ultimately you get D125. You get the active D3. The problem is that conversion is very inefficient, particularly when you're over 40. It's not a very good way to make D. You've read the articles. I've read the articles. The farmers in Minnesota make 10,000 units in 15 minutes.
It's better to be in the sun, is what you're saying.
Well, yeah, you will make some, but after age 40, even if you're in the sun, you're not going to make it. It's not a very efficient process. There aren't a whole lot of foods that have vitamin D in it. Fish does, fatty fish does, cod liver, of course, does. The standard from our grandparents was to eat cod liver oil, and there's some benefit to that. We all need D, but these doses that are being recommended are not something I would do. I read a wonderful article on, I think, with the Autoimmune Research Foundation site, which talked about how these doses that people are recommending are really dangerous. Now, we've seen patients where their cancer is actually, before they saw me, a lot of people come to me when they've already been through everything else, conventional and alternative, been on high-dose D, and weren't doing well at all.
What do you call high-dose D, though?
Anything over 4,000 units I consider high-dose.
Okay.
We reduced the dose, and they started doing better, and often their D deficiencies would improve. I've read evidence that blood levels of D above 60, which are considered low by some, I know Cannell at the Vitamin D Foundation saying everyone should be 100. I've read studies where 60 or above stimulates cancer growth. Look, all nutrients, like any drug, follow a normal distribution curve of activity. What that means is that very low doses or very high doses, you basically get the same problem. The idea that more is better for a supplement is no more valid than more is better for a drug. You need the right dose and the right patient in the right situation to get the right effect, and that's going to vary enormously. I have patients we put on 800 units a day, no more than that, and they do great. We have other patients we will go as high as 4,000, but never higher than that. And in this day and age, because even the conventional doctors are going ballistic with D, they're just loading it on to their patients. That's the one vitamin they've kind of latched onto. We're constantly lowering doses, and people get nervous. Why are you lowering the doses? Just like, why are you taking me off the bioidentical hormones? Too much D is no better than too little D, and it's better to do it to correct a deficiency gradually, because you take too much, the cells get resistant to it. Even though the blood levels may be normal, it won't get into the cells, so in a cellular level, you're still deficient. And people walk around proud of their vitamin D blood levels at 80 or 90, but meanwhile their cells are starving for D because they so overloaded their body. The cells withdrew the receptor, so the D is not getting into the cells where it belongs. So you have to, nutrition is very tricky, just like pharmacology is very tricky. You have to use the right dose, the right form, the right time, in the right way, in the right patient, and then you get wonderful results.
I think the fact that you've been doing 30 years of coffee enemas is very telling about the liver, and you're able to work 14 hours a day. And I noticed that you don't boast about it, but you have no problem sharing that. So it must be profound, its effect. And the other thing I really liked about what you said is that the body knows. The body has its own intelligence if it's guided in the right way, correct?
Right. Totally correct.
We are the pill-popping society. So it's kind of unorthodox what you're saying, which is to trust the body.
One of the greatest lessons I had to learn from Dr. Kelly, who was one of the most brilliant people who ever lived, and certainly one of the most brilliant people I'll ever have met, even though in his later years he went kind of nuts. He said the body ultimately wants to be healthy. It doesn't want to be sick. Sickness is a disease. It's a disability. It's an abnormality. It's a disequilibrium. The body is always working toward equilibrium, and we do everything we can to knock it off equilibrium. And what Kelly said with his program, and we say with our program, we're trying to restore the equilibrium. And once the body is in a homeostatic equilibrium, it knows how to function well. It knows how to get rid of cancer. The body can create cancer. That's quite a feat to create cancer. Well, it's certainly smart enough to get rid of it. If it's smart enough to create it, it's smart enough to get rid of it. You just have to point it in the right direction. Cancer is like any other disease, is a sign that the equilibrium in that particular patient, the physiological and biochemical equilibrium, has been disrupted. And you have to point it in the right direction. And once you do that, the diseases tend to go away. whatever they may be, toenail fungus or brain cancer. Sometimes establish